everybody at Best Practice. So I'm joined here today by Dylan from Redmoor Health. You've been having an interesting day, haven't you? Because you had your session just a short period away. Tell us about it.
I did indeed, yeah, Gandhi. So this morning we had a session on unpacking data from insights to action. Yeah, it was a really good session. Lots of people attending.
Okay, so I can imagine when people hear things about data, first thing they do is switch off.
Thank you very much.
But I know that actually after your session you had loads of people come and speak to you about it. So tell us what you covered in that session.
We did indeed, actually, yeah. We had good feedback from it. So at the session itself, we took practices through 6 data points using Redmoor Health's Digital Maturity Index. That's looking at lots of different data sets from people that use the NHS app, online services, online consultation data, looking at patient experience. So we took practices through how they could actually get benefits from looking at things like GP to GP processes, stop going over 8 days, making it manual. It takes a lot of time then for practices, and it's not great for patients when they join a new practice and the medical records aren't ready for them. It's not great at all. So we just went through some of the quick wins, and the main takeaway I wanted was for people to be curious about data, not to be so afraid of it, and start to look at it in small bite-sized chunks. And yeah, nice response.
Cool. And I guess from your point of view, being here at Best Practice Birmingham and stuff, what's the thing you most get out of this conference?
Personally, I think for me it's networking and just meeting the great people every day that are doing the job. Sometimes when you work for a supplier as Redmoor High, you can feel as though you're isolated sometimes away from them. But actually when you get to talk to the guys and you know we've got a solution or we can help them, it's a really great feeling for them to come and say, Dylan, we love doing that service that you offered, or we loved your social media managed service, and just catching up with people about how they're getting on.
Yeah, absolutely. I know we talked earlier about isolation with particular roles, I guess particularly DTLs. I know you guys have got your communication hub, kind of network building out and stuff and things. I'm still waiting for the invite, by the way. But, you know, I can understand how that will really help people and that collaborative nature. Definitely also get that here, don't you? Talk about the future of general practice.
Exactly, you do, yeah. People coming together, talking about how it is locally for them, what the issues are, and just hearing that actually a lot of people have got the same issues. Should talk more, share more, and I think opportunities like this at Best Practice are great for getting us away from everyday life and just being able to relax and unwind at times that we need.
So I guess, what do you think, hearing from everybody else and chatting to people here at the conference, what's the next big thing for general practice?
Good question. You've asked me this before as well a few times.
Yeah, I know.
I'll have to have a look back, but I definitely think, I know people band AI around and RPA, but there is a use for this. I was lucky enough to attend Redmoor's hackathon last week with Keith Grimes, who did a great session on how we can use AI and looking at things like ChatGPT in everyday life. And I think the enthusiasm from the people there showed me that it's got a big use somewhere in general practice and primary care. It's just making sure we do this intelligently. So
absolutely. And I would highly recommend checking out Keith's stuff. In fact, you can join me and Keith on the 18th because we're doing a session on AI use in general practice.
What a great segue there.
So I will put the links to that down below. Absolutely.
Fantastic.
Also, definitely check out the stuff Redmoor are doing. They're doing some amazing stuff to help general practice, and absolutely one of my go-to people to say, I need help in tech. So if I'm going to them for the help with tech, you know they must know the stuff.
Perfect.
So absolutely, if you're here at the conference, check them out. If you're not and it's over and stuff, definitely check them out on their website, and we will catch you next time.